Yes, good evening, everybody. Welcome to another session. Ask Doctor Fredostar. The time is 7:01 p.m. Yes. And today's date is 22nd of February. Now, the reason I'm making this time stamp is because I have noticed that whenever I come online, I have the live session like this. After ending the live session, some people come online, they'll watch this live stream, they begin to send me comments. Oh, doctor, good evening. Good evening, and then I'm not responding, and they are like, this guy is ignoring me. No, I'm not ignoring you. It's just that you are not watching the live anymore. We have ended. So look at your time, please. If your time is not 7:01 p.m. right now, or wherever you are in the world, wherever you're watching me from, I don't know what it is over there, but the time here in Lagos, Nigeria is 7:01 p.m. or now 7:02. So I beg, so that you will be dropping message and say this guy is not responding to me, because after ending my live stream, I noticed that people start dropping comments. Doctor, good evening, this is my problem, what can I do? And then they're like, you're not responding to me. I'm not responding because I'm no more live with you. But right now I have 12 people on my Facebook and my YouTube live with me right now. Also, I'm live on TikTok and I have about 13 people already. Evie is live with me on Facebook. Good evening. How are you doing? Evie I'm doing very well. How are you? Over here in London, it's 6:02 p.m. Okay, well done. Okay, does this have any cure? Depending on the cause of your tinnitus. Yeah. Who they call me? Connie, how are you? 19 people online on TikTok. Is it TikTok? No. 18 now on Facebook and YouTube. Good evening, Vivian. Vivian, good evening. Christy, is it Christy? Yeah, Christy, good evening. Felicia, Felicia, good evening. Alfred, where are you joining me from? Alfred, good evening. Patricia, Patricia, good evening. Who again do we have here? Efe, Miles Castro, I see you. King Luther is joining us from Warri. Okay, welcome everybody. And how has been your day? I have a bad cold and chest infection. What do you recommend? What do I recommend? I recommend you go to the hospital, my dear. Hmm? I recommend you go to the hospital. If you have a chest infection, you should go to the hospital, please. We don't recommend medications on social media for people. So I don't know what you have. I don't know the extent of your chest infection. The best advice I'm going to give to you is for you to go see your doctor. Yes. So we have somebody here, Zobright from Ghana. Who again do we have here? Jane, good evening. Jane, how are you? Patricia is joining us from Calabar. Calabar. Okay. Welcome, everybody. So let's interact. My 3 months is losing her hair. Hope all is well, Lo. Losing her hair, how do you mean? Connie, how do you mean? My 3 months is losing her hair. Hope all is well. I don't understand what you mean by losing her hair. Okay, Latifa. Latifa from Satellite Town, Lagos. Latifa, how far? How you day? Oh yeah, now maybe we interact small. How many minutes I get today? Maybe 30 minutes. Mabel, how are you? Okay, I beg, share this live stream, I beg. Mercy, Mercy is joining us from where? Mercy on Facebook. Mercy is joining us from Italy. Yeah. Mercy, how are you? What does closed uterus mean? What do you mean by closed uterus? Where did you get that word from? I don't know what you mean by closed uterus, my dear. So I'm live on Facebook, I'm live on YouTube, and I'm live on TikTok. Doctor, I have shared on many platforms. God bless you. Thank you for sharing the live stream, King Luther. I'm going to pin your name here. for a while. Thank you for sharing. People come to my page, they know they share, they know they support like that. Um, they know they support. So thank you for sharing. How are you, Doctor Portia? Portia, I'm doing very well. How you doing? Let me pay attention to those on YouTube a little bit. Doctor, good evening. Please talk about low blood pressure. There's a video on my page on low blood pressure. Lucy Emmanuel. There's a video on my YouTube and Facebook page on low blood pressure. Please scroll through my page and watch the video. Yeah. Okay. Let's take some comments on TikTok. Let's take one or two comments. Let's see. So I'm asking the question here. From a friend scan result. So I come, my dear. That result is not reported well. There's nothing like close. What do you mean close uterus? Uterus is normal. Yeah, there's no problem with the uterus. Full stop. Full stop. Full stop. I'm not going to comment more on that because I don't know about the scan result. But basically, I think the uterus is okay. There's no problem with the uterus. Uterus is not supposed to be open, my dear. Open. Okay. Evie says, I have shared it. Thank you for sharing. OJ, thank you for sharing. Alfred says, let's see. I have shared your page. God bless you. Thank you very much. So let's take comment again on TikTok. Let's see if we have any question here. Please, Doc. I've been trying to conceive 2 years now. I'm having a regular period and I'm finding it hard. Lizzie, 2 years. Okay, sorry. It's not easy when a woman is trying to conceive and is not forthcoming. Most times there can be emotional challenges, basically meant also mental challenges, and you are worried. Now I want to find out from you, what have you done? Have you seen a doctor? Have you seen a gynecologist? Or you are just at home? Tell me. Janice Foster. Janice, how are you? Okay, let's take comments on Facebook. Let's go back to Facebook again. Latifa says, I have shared. Thank you for sharing. Rachel, I have shared. Okay, good. Thank you for sharing. If you have any questions, ask me. Ask me. Efe, thank you. Ask me. People on TikTok are asking me questions, and I really pay more priority to those on Facebook. No offense, guys. I pay more priority to those on Facebook and YouTube. You know why? TikTok, TikTok to me now rubbish. A rubbish app. TikTok now very rubbish app. I swear to God. But because I have a lot of people on this platform that interact with me very well, so I try to come online. Normally, I find they do TikTok live again. TikTok now rubbish. You put in so much energy, you're teaching people, the algorithm will not even push your video and whatever. So, those on Facebook and YouTube, please ask me your questions. Let's see. I'm good. How far? Ideal. I'm good. I'm good. Clara, good. How are you? I'm finding it hard to know when I ovulate. Madam, there are videos on my page to help you with ovulation. There are videos on my page to help you with ovulation. Now, please, when you come to my page, I beg, I don't know where you watch me from. It's not even easy making videos every day anymore. It's very hard. But when you come to my page, especially for those who are having problems with menstruation, ovulation, and the rest, go through my page. Just try to go through my page. You will see a lot of videos that will give you the answers you are seeking for. Yes, please go through my page. I don't really get time to do skits, all those very, very short. I tried making my videos a little bit detailed to help you. So if you're asking me some questions, the videos are already on my page. Basically, you can find them on YouTube, you can find them on Facebook, you can find little clips on TikTok. See, I'm appealing to everyone to share this life-saving information from our dear. Someone needs this information. God bless you as you share and tell others about the videos. Thank you very much. Thank you. I appreciate it. Okay, let's take comments on TikTok and then I go back to Facebook. Let's see. Let's take. I've gone to hospital. They said I'm having hormonal imbalance. Okay. So what did they do for you? What did they give to you? We have a comment on Facebook. What causes sleepless nights when you are not stressed or tired during the day? There are many causes of sleepless nights now. Sleepless night means you're having problem with sleep, insomnia. There are many causes of insomnia. It could be your kind of job, my dear. It could be the job you are doing. We have what we call biological clock or what we call the circadian rhythm. During the daytime, you're supposed to be awake. At night, you're supposed to be asleep. But sometimes this clock, this rhythm can change. Instead of you to be awake during the day, you feel sleepy during the day, and at night you are awake. It can change. Other things can affect your sleep, your lifestyle. Some people who take caffeine, energy drinks, you can have problems with sleep. You can have life events around you that can affect your sleep. These are very. Thank you for the gift. Thank you very much for the gift. Those on Facebook, don't forget to send me stars. Send stars. Thank you very much. I appreciate your stars. Um, Clara Gold is sending me gift on TikTok. God bless you. Thank you so much. So there are many factors to consider if you can't sleep. Do you know your age can be a factor too? This is why I tell people that social media is just a place to educate you. So I can't really tell you what exactly is making you not sleep. This is why you have a one-on-one discussion with your doctor. You also will have a robust discussion with you to know what is going on and then offer you the best solution. Hmm? Let me take another comment on Facebook. Clara, thank you for the gifts. God bless you. Ladies and gentlemen, please follow my gifter. Follow my gifter. Just follow her. That is how to appreciate them for me. When both breast fibroglandular tissues appears hypoechoic, does it require surgery? Come, my dear. You have a scan result with you, Abby. You have a scan result with you. So you are reading the scan result for me, madam. True of us, you have a scan result. So you are reading what you've seen in that scan, and you are telling me, so I should tell you whether you are going for surgery or not. No comment because I don't know anything about your breast. I don't know what complaints you have. So I can't tell you if you're going to go for surgery or not. Hmm? It's not if maybe you saw a medical doctor and they advise you to carry out a scan and you have carried out the scan, the best advice is to go back to the doctor, let them see your results because I don't know anything about you. So I can't tell you if you are going for surgery. I don't know your complaint. I don't know anything about you. Hmm? um Hypoechoic does not talk about surgery, please. This is one habit people do. um they have results like this and then they are sharing to you to tell them surgery or not. So nobody's talking about surgery here, madam. Kiki Vera, what we should be talking about is why did you go for this scan in the first place? Who sent you for the scan? Do you understand? These are things to put together. What are your symptoms? Basically, your doctor will review all this and then tell you, oh, don't bother, relax. Oh, take this medication. Oh, maybe let us do a biopsy. So I don't know what is going on with your breast. Hmm? Okay, let's go to TikTok and take some comments on TikTok. Let's see if I have any question here. They gave me drugs, but no difference. I'm still having a regular period. When was this? When was this? And did they tell you to come back? What hormonal imbalance do you have? Which hormones exactly is not okay? And then which hospital did you go to? Yes, tell me. So let me take comments here on Facebook again. Please, doctor, talk about ovarian cysts. Okay, okay, I will. There are many types of ovarian cysts, but the common type of ovarian cyst is what we call the follicular cyst. It's common in women in their reproductive age group. Sometimes it can give them symptoms like pain, can even get infected. So there are many types of ovarian cysts. Some women can have cysts and yet they will give birth. Fine. Sometimes it can be very disturbing. But to make a detailed video on ovarian cysts, that will be later in the future, not anytime soon. I can't promise that I'm going to make a video on ovarian cysts anytime soon. You get? Or maybe when I have a guest, a gynecologist on my page again, you can ask the question. Maybe the guest will help us, but it won't be very detailed, you know. Let's see. Let's take one question again on TikTok. Niger cashless policy if it gives person sleepless nights. True, true, very true. Sugar, how are you? Thank you, Clara Gold, for the rose. Ladies and gentlemen, please follow my gifter. Anybody that sends me gift on this live stream, that person is simply encouraging me. That is all. So make una follow them. Hmm? Okay, so let's take another question here. Kenneth says, Doc, is there something like ovulating during period? Yes, there is. It happens. It can happen that a woman can ovulate during her period. It's not very common. It's not common per se, but for you to really understand that the woman is ovulating during her period, it means that the woman must know the length of her menstrual cycle. She must know, then she must know her ovulation, because sometimes the woman might be on her period. As she's about rounding up her period, she might be ovulating, and if she has intercourse during that period, she can get pregnant. um yes, thank you for responding. I should bring you up. I'm sorry, I don't bring people up on my page unless you are my moderator, or you are a medical doctor, or you are a long time follower of my page, or I'm just ready to have a random chat. But today I'm not bringing up anybody, please, no vex here. Okay. Somebody's asking us a question. Doctor, how can we end the HIV epidemic? How can we end it? We end HIV epidemic by raising awareness. Do you know that some people still don't believe that HIV is real? People still don't know anything about HIV. This is why we keep educating. Educate people. They should understand what HIV is. They should understand the symptoms of HIV. Thank you very much for the gifts. God bless you, Clara Gold. Thank you so much. People on Facebook, has anybody sent me stars today? Nobody has sent me stars. Okay, let's see. Let's see how many people have shared the live. Who has shared the live? Doctor, how can we? Only 3 people don't share this live. Ha! I beg, make una day first. Make I give una chance. My face TikTok. HIV. Thank you very much for the gifts. God bless you, Clara. Okay, let's do this. So, let's see. So you end the HIV epidemic by educating people on HIV, the causes of HIV, transmission of the virus, symptoms, and how to prevent HIV. We have been doing this, we keep doing this, people still don't know. So we encourage everybody to know more about HIV. Maybe one day again we'll talk about HIV. Let's take comments on TikTok. Clara Gold, God bless you. Dr. John is here. Dr. John, are you here? Dr. John, come Facebook, I beg, yeah? Doc, they didn't tell me. They just gave me drugs for injection because they said it might be infection. Which hospital is this, my dear? So please listen carefully, guys. Whenever I interact with you, I always tell you something important. I tell you that when you see a doctor, please ask your doctor questions. Ask your doctor. I'm not your doctor. I'm just a doctor educating you on social media. I'm not your doctor. Do you understand? Please don't be offended with that. Whenever you go see your doctor, ask your doctor questions. I'm not saying that your doctor will have all the answers, but when you see a doctor, please, what might be the problem? What are you thinking? Okay, this is what we are thinking. Let's do this test. Okay, take these medications. This is what I think you have. Take these medications. It might do this and do this for you. If you don't feel better, come back. But are you sure? Please ask. Ah, listen, I'm not telling you because I am a doctor. I'm telling you because I'm a human being. And every human being at one point in time would require medical care. Doctors too, they fall sick. Abi, you don't know. I lie. Doctors too, they fall sick. So when you go see your doctor, please, guys, ask questions. Now look at what Lizzie Gold is telling me. So she has irregular period. She was told she has hormonal imbalance. They gave her medication. They gave her injection. So I asked her, what hormone is imbalance? She said she doesn't know. They gave her medication for infection. Now it doesn't rhyme. It doesn't go together, my dear. It doesn't go together. There's nothing like they are treating you for hormonal imbalance and you're taking medicine for infection. So it doesn't go together. Maybe you don't understand what they said, or that's what I think. Yeah. Okay. Let's do this. Let's do this. Let me take questions on Facebook. Doctor, my stomach they big after I do family planning. I even they gain weight and I never conceive again since then. Over 9 years now. Wow. I go for test, them say na staff, which I don't treat tire. Doc, I beg now waiting I go do, especially for the belly fats. Okay, Latifa too. Let's do this. Let's interact quickly. So I'm waiting for your comments in the comment section here. 9 years, you never get belly, you never born. Wow. Who you don't see? Who have you seen? What have you done? You go do test. Who send you for test? Who treat you for staff? Who give you family planning? Are you trying to get pregnant or na the belle fat be the problem? Who have you seen for 9 years? What have you done? Please tell me. Let's talk quick. I don't get time. My time is what? I have how many more minutes here? Make una share the live for me, ladies and gentlemen. Share. Don't just be looking at me without supporting, please, guys. Eh? Ah, please. See, I dey use the word abeg. Biko, jaw. Share. So what's your Latifa 2? I'm waiting for your comments now. I'm not seeing your comments. Latifa 2, what have you done? She's not responding. Okay. Latifa 2, she's not responding. Let's move on. Let's go somewhere else. What are the symptoms of cryptic pregnancy? The video is on my page, madam. Go to my YouTube channel. I made a video on cryptic pregnancy. Yeah. I made a video. The video is about 10 minutes. It's not on TikTok. Okay, so she says, I have been, my last baby is 9 years now. I have been to hospital and even about two. So what is the problem? What did they say is the problem? Let's do this. Um, w- Good evening. When is the right time for a pregnant woman to start antenatal? Sincerely, the right time would be immediately you know you are pregnant. But in this part of the world, they will tell you to wait till 8 weeks or 12 weeks. But the best advice would be immediately you miss your period, see your doctor. I'm not saying register, see your doctor. If there's any problem, they will tell you, okay, fine, just take these medications, go home, they'll check your blood pressure and take your blood and the rest. They'll tell you go home later, you can come back. But some women will wait 3 months, 4 months, which is very bad. And there's a high tendency that there might be problems. So I don't know where you are based. My own advice, the moment you miss your period, especially if you know you're trying to get pregnant or you're looking for this belay well, and you now know you are pregnant, just go and see your doctor. I beg you. Yep. Let's take another question here. Okay, thank you. Doctor, how can I get to talk to you privately? Oh my god. There's a message on the screen, my dear. Um, I don't do private chat on social media. Please. I don't do private chats. Uh, I see on social media, I don't do private chats inbox with people. But I do chat with people off this platform. That would have to be via consultation. You would have to book for a time. I don't have that time. There's a link on my page. If you are okay with that, it's fine. There's a link on Facebook. There's a link on TikTok. There's a link on YouTube, on Instagram. Click on the link. Somebody will chat up with you. You will book for a time. We can interact. I beg, no vex. I know normally they chat with people in the inbox. Then I want to chat with you. I know they do. Yeah, yeah. Okay, good. Let's see. Hey, Malgafa now. So no vex, ladies and gentlemen, listening to me. I don't do private chats. There are many reasons. I keep saying it whenever I come online. If you want to chat with me, please, there's a link on my page on Facebook or wherever you are watching me from. Click on the link, drop a message. Somebody will chat up with you. They will tell you to pay for the time. Please, no vex. Yeah. How far now? How work? Okay, let's take comments on TikTok. On TikTok, let's see. Let's see. Let's see. Someone says, Doctor, please, I had my period around 7th of this month, and I'm having it again 3 days today with pains. 7th. Today is 22nd. So, Queen, what is the length of your menstrual cycle? Sharp, sharp. What is the length of your menstrual cycle? Okay, let's take some comments on Facebook. Somebody's asking us a question here. It says, is it okay to eat egg every day? It's not okay. It's not really okay. It's not really okay. Yeah, it's not really okay. So there's a saying that says too much of everything is bad. So if you're going to eat egg, at least you give your body time. Don't really take egg every day, especially if you are now gradually becoming elderly. Yeah. Uh-huh. Give your body break from egg. Yeah. 28 days. So if your menstrual cycle is 28 days, basically, um, you should be seeing your menses like once in a month. Your period once in a month, 28 days. So let's say you start seeing your period. Let's say you start on the 1st of this month. Your next period might be on the 29th of this month. There's very high tendency that you can see your period also in this same month if you have 28 days. And if it's regular, sometimes there could be little change. But if your period started on the 7th and now 22nd, if this is the very first time in your life, please don't panic, just relax your mind. But if this has been happening to you repeatedly, more than 3 months now, speak with your doctor. God, my God, my head is banging. My head is banging. Please share this live. Somebody should send me stars now. Nobody has sent me stars tonight again. Why? Okay. Hi, please talk more on people that experience bloating stomach without ulcer. I don't get it. You can be bloated now. You don't need to have ulcer to have bloated abdomen. Hmm? You don't need to have ulcer, abdominal and peptic ulcer disease to have bloated abdomen now. There are other causes of bloated abdomen. Ulcer, bloatedness is not a very common symptom of peptic ulcer disease. Do you understand? Yeah, so there are other causes of bloated abdomen. It could be from your GIT, your gut flora, the microorganisms in your guts. They are now very, very much. They are producing too much gas. That is why you're having that. You understand? So it's not all about ulcer. Let's take comments. Let's take comments. Let's see. I have a call here. Hello, hello. Yeah, how far? Who's Crystal? Okay. Sorry, guys. Sorry. Doctor, why do doctor advise couple to stay off sex life first 3 months of pregnancy? Eh, where did you hear that from? Maybe see come maybe there's a problem somewhere, that is why they are telling them. It's not for everybody. Oh, nobody will just tell you because you are pregnant everybody I stay away from sex. That is not true. They don't tell everybody because you are now pregnant, madam, stay away from sex. The only reason might be maybe because when you have sex at the very early stage, the woman might have contractions and the rest. But nobody will say because you are pregnant, everybody, the moment you get pregnant, leave sex for 3 months. It's not true. It's maybe for that particular person that they said it. So find out more. We don't. You can't just generalize that comment for everybody. Oh God. Let me take comment here. Rose, how are you? Um, let me see comment here. This is the first time. Okay, relax your mind. This is the first time, and don't panic. Don't panic. Relax, queen. Doctor, I saw my period just twice this month, and it was dropping the remaining 3 days. And calm down. It's dropping gradually, and it's still okay now. I've done pregnancy test, is negative. So what's the issue? Please, can you explain how to count your ovulation? The video is on my YouTube, Grace Godwin. Go to my YouTube channel. There's a video on that. Good evening, Empress. There's a video on this. Go to my YouTube channel, please. Yeah. Please. Let me Facebook and YouTube. Doctor, what can someone do for the person to start seeing her ovulation, egg white, although the symptoms are there? Did anybody say that everybody must see egg whites? Did you watch my video on ovulation, Chioma? Did you watch my video on ovulation? Nobody don't send me star this night. Okay, oh, my time is almost up today. Chioma, did anybody say that you must see your egg white before you know that you are ovulating? Madam, did anybody say that? There are videos on my page. I just noticed that most people know they watch and waiting we like to they watch now. Waiting go make us laugh. Hey, 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 hey. This thing funny, die. I lie, all this stuff. Sorry, we can't do that. We are making videos to educate you. So when you come to my page, I beg in the name of God, please, if you want to know about ovulation, you want to know about menses, you get problem with your menstruation, videos plenty, videos plenty for my YouTube. Watch, just go my YouTube page. You will see video, you will tire. No vex. But nobody said you must see egg white before you know you're ovulating, madam. Thank you. Sandra Agbon. Sandra, how are you? Somebody says, give me the reasons for vaginal infection keep coming back. Alpha, Alpha. Yeah. Thank you. Is it very urgent? I will need to call. Do I did live stream? When I end, I will call the phone. No, 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 no problem. But when I end, I will call someone. I will let you know later. And when you come back, I'll give you updates. Yeah, yeah. It's too much. Yeah. Okay. So somebody's asking us a question. I'm sorry, guys. Somebody's asking us a question. Evie says reasons why somebody keep having recurrent vaginal infections. There are so many reasons. So it might be due to poor treatment, it might be due to resistance, um poor treatment, resistance, or lifestyle. So many things they will cause them. So there are many reasons. The person not treat himself well, the person no treat like this, see medical professional, or the person get resistance, or you get within the person they do, where they always bring this recurrent infections, sex life, hygiene. hmm? They put things inside the vagina anyhow. These are things where we bring all these recurrent infections. You understand? Yep. God. I need to end the live stream now, guys. I really do have to go. Long time, Roslyn. I feel pregnant. Okay. Doc, I gave birth through CS in 2021. Okay. You feel pregnant. You have done a pregnancy test, is negative. And calm down. Calm down. Calm down. Are you trying to get pregnant again? If you feel you are pregnant and you've done a pregnancy test is negative, speak with your doctor. May them do test for you again. Maybe you know doing well, or basically you know they do it the right way. So make them check you. If they check you, they might discover that you are pregnant. And if they check you and you are not pregnant, they will tell you you are not pregnant. That is the best thing to do now. Hmm? Oh boy, oh my god. Time to end this live stream. For those that want to know about ovulation, the signs of ovulation, there are videos on my page. If you are just following me on Facebook or on TikTok, Clara, thank you. God bless you for the gift. God will bless you. If a money, I greet you. If you are just following me on my social media platforms and you want to know about ovulation, I beg you, Biko, please, I don't know how else to say this. Scroll my page, just scroll my videos. Just click on my page, click on videos, just scroll down. You will see video there. Sit down, watch them. Yeah. Or go to YouTube, watch video. Some people know they watch my video. Now only post that they like, all those written posts. So you are asking me the same thing every time, every time, every time. Somebody go ask me 10 minutes ago, another person go ask me. That is why we make this video. So I beg you, if you get issue with your ovulation, you don't know how to calculate your ovulation, you don't know about the signs of ovulation, you don't know about infertility, about fibroid, you want to know about recurrent, these videos are online on YouTube. Basically, you will find all of them there. Eh? Yes. I beg. My head, the bang. That is what they always say. No, here, oh, in India. Okay, in India, that is what they always say. Okay, maybe they might have their reasons. They might have, if that is what they all everywhere, they might have their reasons. Sometimes it might be that because at the very early stage of pregnancy, if you go get engaged in sex, and the man they knock the woman, jaman, assisting and fights, if he make the woman lose the belle because as he dey knack the woman, if he give her one kind of small contraction for the uterus, so you get maybe, eh? So, but I don't think anybody will just say if you make you get belle, leave intercourse like that. Oh my god. I'm back home now. Olive Branch. I was abroad. Oh really? I know this guy. Baba far now. Olive, how far? Long time. How are you? Good evening. Please tell what to eat when breastfeeding baby. When you are breastfeeding your baby, eat all your food. Please eat all your food and take your multivitamins. Avoid any medication not prescribed to you by your doctor. Avoid alcohol. Avoid cigarettes. Eat your normal food. Take your multivitamins. Take your multivitamins that would help you with your blood too. Hmm? Yeah. What is the cause of changing period? Oh God, I don't die. What are the causes of bleeding after sex? The video is on my page. I made a video on my page. Somebody says, please answer my question. Um, I can't see your question. Your name is Wallace Dumboya. I'm sorry, I can't see your comments or your question. Lucy, how are you? The causes of bleeding after sex. I made a video. The video is on my page. Nice topic. Goodness, how far? Ireti, how are you? Okay, I don't try today. You don't do how far be now? I don't try. I think I have to go now. I don't try, really, guys. Me no vex. Um, Bleeding after sex or bleeding during intercourse. I made a video on that. High blood pressure. I made a video on that. Cryptic pregnancy. I made a video on that. Ectopic pregnancy. I made a video on that. Anemia. I made a video on that. Toilet infection, staphylococcus, peptic ulcer disease. I made a video on that. What again? Weight loss, um, recurrent dizziness. I'm just trying to bring it off my head. So there are so many videos, guys. The best you can do for me is to watch them. Even if you know go send me, even if you know go send me gifts, you know go send me anything, no problem. But watch them. Why what? Why what? Someone says why? Why what? Why what? Goodness, Victoria says why? Why waiting? Why waiting? Wallace, I'm about ending the live stream, so I can't see your comments. Uh, I can't see your comments, my dear. I can't see your comments. Sorry, I don't know if you be elder, no vex. I can't see your comments. Okay, anymore. I'm waiting for you. Someone says, Doctor, answer me now. Answer you what again? Latifatu. What should I answer? What should I answer? Tell me. See, I did answer the questions as I did see them. Okay. Doctor, what would you advise someone who had inflammation of the brain and is still alcoholic? What would you advise the person? What do you mean by inflammation of the brain? What's your name? Onyebuchi. What do you mean by inflammation of the brain? Hey God, please, I'm not trying to be funny. I'm being serious. Help me so that I know how to answer this question. Don't worry. What do you mean by inflammation of the brain? And Joe, break it down. Belly fat. Okay, you want to burn down belly fat. Oh, that's your concern. Hey, if you want to burn down belly fat, it's hard work. Um, Calorie, diet, your diet very important. Your diet, what you eat, important. Then exercise, important. Your food, what you're eating, and exercise. There is no medication that would burn down abdominal fat for you, madam. There is no slim tea that will burn down abdominal fat for you. Your food, the kind of food you eat, reduce junks, high fatty contents, food with high cholesterol, um, a high carbohydrate intake, reduce them. What again about the time you eat? Try not to eat late at night and then exercise. Basically, what is the cause of period changing? Many things can change your period. Many things can change your period. Oh God, my head. I don't tire. Many things can change your period, like stress, like age, like sickness, certain medications, stress, your age, sickness, certain medications, hormonal imbalance can change your period. Thyroid disorders, problem with thyroid hormone can change your period. Weight loss, extreme weight loss or extreme weight gain can change your period. I know they vex for you now. My head, I know they vex. No, I know they vex. I won't stay more, but I don't tire. I have to go. I know they vex for you. Huh? I know they vex. I know they vex. Trust me. So I've given the answers. Many things can make a woman's period to change. Age, stress, even her nutrition, hormonal imbalance, medication, thyroid disorders, weight gain, weight loss. What again? What again? What again? Have I exhausted my head? These are basically the ones that are off my head now. Okay, thank you very much. So those on TikTok, yes, Latifa too. Yeah, thank you. Okay, I have to go now. We have to call it a day. Onyebuchi, I can't see your comment. Oh, no comment again. We on TikTok. Snowy Alpha, Alpha. So guys, take care of yourself and have a wonderful day. God bless you. I they close charity and now you they come. I don't end. No vex. I've been here for the past 45 minutes. Yes, and I have to go now. I'll see you later. Take care and bye bye. Remember, good life. Sense.